I'd like to call the meeting to order at 4:07 p.m. and ask if there's any public comment. Anybody online? No?
This is Pat here. I'd like to ask a question about the testing, but perhaps it might be better to ask that question later after Christopher's had a chance to report on it.
Up to you.
Yes, we can wait till later.
Okay.
Okay, thank you.
That would be better. Sure. Okay, any other comments? If not, I'd like to ask for approval of the minutes, first from the meeting from the 13th of October. Are there any corrections or additions? Well, it's definitely as printed, okay. That's carried. And then from the budget session of October the 26th, there any additions or corrections? I'm going to make a motion to approve that. Second, it's approved. Thank you very much.
Sorry to interrupt. Make sure you talk towards me.
Okay.
Please. Thanks.
Okay. Moving on to the financial report. Abby?
Hi, good afternoon, everyone. Today we have November warrants that total $24,394.39. And the total for payroll, which is $14,676.26. And this includes Chief Carlton's salary of $5,541.67, and along with Chief Shields' pay of $3,175.83. And there were 2 events for the commissioners and the board secretary. And the total payout for volunteers, warrants included, is $5,888.50. We'll have the October financial statements for your review. So today we're looking for board approval for the warrants and payroll for November, please.
Thank you. Can I have a motion?
Yes, I move that the warrants and payroll for the November are approved as presented.
I second that. That passes. Go ahead, Patty.
Great, thank you. And then just a quick update on the remaining 2021 budget. As of October 31st, we currently have 25.66% left in the budget. That is compared to 30.98% the same time last year.
Any questions on that? No. Okay, go ahead.
Okay, and then I believe on the agenda is the next item, which is I have 3 cancel warrant requests. And these are all for the same vendor, Christian Craig, who is a volunteer. And I have the original checks in hand, but what the situation was, there are 3 checks that are $13 each. And he took them to his bank recently, but they did not honor cashing them since they exceeded 180 days past the written date. So these can be void per board in one motion, but I'm going to read off the warrant numbers and the dates and the amounts just for the meeting minutes. The first one is warrant number 011-21575 in the amount of $13, and it was dated February 16th of 21. The second one is 011-20709 in the amount of $13, dated January 26th of 21. And the third warrant is number 011-18859, also for $13. And that was dated December 15th of 2020. So it's a total of $39, and I have re-entered that $39 as part of the payables for this month. So this is just a formality for the county, so we can have those void and credited back to our account.
Do we need to do anything further other than it's just documented?
Make a motion and second it.
Okay,
I move that the $39 transaction be approved as presented.
my second motion here. Been moved and seconded and approved for the $39. Next. You have anything else, Patty?
I think that's all I had, other than Chief going over the budget and the levy increase.
Okay. Thank you very much, Patty. I
Thank you.
greatly appreciate that. If you want to do the budget update now, or do you want to do it during your?
I'll do the chief's report and then I'll have to present the whole budget as I did last time to the general public. And you guys would have to make a motion to approve it or to make changes on it prior to approval at that point. And then I was looking at the executive session. Pat has a question about the testing. I can answer that in my chief's report or under new business, but if I do it under new business, then I would ask that we probably move new business up and the executive session last, just so
Yes.
people don't have to stick around
We should have it last. I thought it was going to be.
for that.
Yes.
Okay.
And is there any correspondence before we start?
Hundreds of emails, and I'm not even joking, about COVID testing, the cost of COVID testing when we have it. A lot of people are not going to the All Point Bulletin. They're not going to Nextdoor, Point Interface, Pause. And I've been trying to guide people to those locations. So if they own a property here, they can have access to social media and understand what may be going on in the community that they can participate in. But we've had hundreds. I'm not joking. And so that's my correspondence. There were some thank yous within those correspondence as well. A lot of people really happy about what we're doing and what we're able to provide to, but there was the opposite of that as well. I'll bring up. Can everybody see this? This is my chief's report for November 2021 for October, the month of October 2021. COVID testing again is Sundays and Wednesdays, 9 to 11 a.m. We may adjust that slightly because today we had 170 people come through our testing site. We knew we were going to get an increase, and I was projecting around 200. The person who won that was Virginia. She got the closest number to the amount of people that we had come through the testing. Everybody was really pleasant, I would have to say, but it was a constant 2.5 hours is what that took us today. So we may change or go in earlier at 8:30 in the morning. So we're done at 11. This Sunday is going to be another test for us in regards of COVID testing. And then in the afternoon, we have a vaccination event. And we're looking at probably 300 people for that vaccination event. So that's going to take us a few hours as well. But I'm hoping that we can end with testing at 11, give our people, our volunteers some downtime before we have our meeting at noon and go into the vaccinations at 1. Maintenance is coming up for all of our engines. So engine 58 is going in for maintenance this month. Engine 5802, engine 5803. Right now, 02 is in maintenance. Which one's next? 03 will be next, and then engine 58. We still have 46 members, 30 Canadian, 10 Point Roberts, 6 county. Of those 46, we have 5 paramedics on staff, 11 EMTs, 5 advanced EMTs, 2 ambassadors, and 36 firefighters are among those. Volunteer hours for the month of October 2021, 2,225. Volunteer payroll, if all volunteers were getting paid, 8,428. I worked 181.5, Assistant Chief Shields 124 with total hours of 305.5. Total calls, we had 35. Is that correct? We had 35 calls. Yeah, we had 35 calls in the month of October, so it was a busier month for us. EMS calls, we had 13. We transported 1 to St. Joseph's. Airlift Northwest came in and got 3 of our patients. We had 8 no transports, so refusals, patient refusals. We transferred 1 patient to a county medic unit. And then we had 13 EMS cares or community paramedic visits last month, 1 law enforcement assistance. We had 8 classifications of fire calls. We had 1 outdoor burn that was permitted. We had 1 illegal burn. We had 1 false alarm. We had 2 power line incidents, so power outages. And we had 2 fire training incidents and 1 water problem. So that concludes my report for the month of October, November 2021. Do I have any questions?
Any questions? No. Thank you.
Okay, so Pat, I'm happy to receive your question.
Okie dokie. My first question is, you've got this vaccination clinic on Sunday. Can Canadians get vaccinated? And if so, does it cost them? And what's the vaccine?
Sure. So we have Moderna and J&J available this coming up Sunday. Again, I've received close to 300 emails. So some of those have 2 or 3 people on the email. So we're going to have 300 plus is my projection. The majority of those are going to be Moderna, and it's a half dose from previous. So it's going to be a 0.25 milliliter dose versus a half a milliliter for the injection on the booster. And then J&J, we're still conferring with J&J, making sure that we get the dosing following federal guidelines on that. And anybody within our community can get vaccinated. I do not believe there's a cost for anyone with this vaccine as it's federally provided. And I don't believe anyone that's come through our sites previously that were international travelers were billed for the shot. The billing from the state or the feds. Now the billing may come from the clinic. The clinic may be able to charge a administrative fee for record keeping, and that's to everybody. So that would probably go to insurance first if somebody had insurance, but I think the administrative fee is around $20 or $40.
Okay, so going to testing, I confirmed that with the health clinic that they have not and do not intend to charge for anything involving the COVID testing, and I believe the vaccination as well. And in your latest notice to the public, you talked about how the possibility that people to get charged from the clinic, from Northwest Labs, and not have it reimbursed from the state. Is there no way of hammering down what the state will or will not pay? I mean, supposedly, as you said before, we've got a purchase order with the state, and they're taking care of all testing. Is there no way of getting confirmation from them? Because there's a lot of confusion out there, and it seems that the explanation changes every so often.
Yeah, so I've tried to stay as consistent as possible. I've never said it's free. I've never said it's guaranteed that it would be covered. So my most recent one was trying to explain the process if you do receive an invoice, because mistakes happen and people may receive an invoice. And if they do, then I've asked them to call the biller. So the person that invoiced them, which would be Northwest Labs and or the clinic. That's the first I've heard about the clinic not charging for the input. And Commissioner Lester, works for the clinic, and she's usually the one that signs off on that stuff. So I did not know
that came from me from Barb, who checked with Dr. Sean.
Okay, that's great news. If the clinic's not going to be charging an administrative fee. The state is very difficult to get a straight answer from, and I think you probably understand that to a degree. We are under a purchase order. We are under agreement that invoices would be sent to the state for processing. But that doesn't mean that the state would not be able to kick that back to a particular individual and ask them to pay or to pay a level of the invoice. So I don't know what else I can do in regards to other than you calling the state and you asking the question. I've heard as well that people that don't have social security numbers, the lab will not forward those to the state. I heard that from an individual who called Northwest Labs. I have not heard that. There is so much information going around, Pat, about this that I've tried to be very consistent on telling people that if they do receive an invoice, to call the biller, let them know their current situation. That is that they're an international traveler, they don't have United States insurance, and or they don't have the ability to pay that invoice. Therefore, that should be forwarded or again forwarded back to the state for payment. And we'll see where it goes. I don't have anything better for you in regards to what I can provide people. Because I just don't control the lab, I don't control the clinic. And if for some odd reason someone does get an invoice that wasn't forwarded properly to the state or the state kicked it back, then that's the process that's currently in place.
Do you have a contact at the Department of Health at the state?
I can provide that to you, yes.
Okay. I think the free is sort of confusing people, because when people say, oh, it's free, it means it's free to them. Everyone understands that. Of course, these things cost some money, but if they're not going to get charged for them, then to them it's free. And I think the message is getting confused when we keep on saying, well, it's not free. It could come back to bite you.
Well, the Canadians, the international travelers coming in from Canada have a choice to get tested in Canada. They can utilize that for 72 hours. That test costs more than the cash pay of what Northwest Labs test cost. So Canadians can spend $200 Canadian, or basically 150 US or 150 Canadian here for a test, and utilize it for 72 hours both ways. Now, today, again, I heard information, which I have no validation of, that the United States federal government said all testing would be paid for COVID. And I don't have any validation on that, but somebody came up to me and wanted me to look into that. And I asked them where they got it. And they said it was on a news ticker that they read this morning. So, the state has stated that they'll support the program most likely through the end of the year or until FEMA funding runs out. And I don't know what that means about FEMA funding. And I don't know what that means if they don't support it. Now, they've wanted to move us to the public health lab in Shoreline, which is it's a much more economical cost than it is using Northwest Labs in Bellingham. But with that, there's more logistical issues for us if that was going to be put into place. So I'm not supporting that move to the public health lab just for cost appropriations when this community's been through tremendous things over those last 19 months. And we're just trying to get people into the community. Now, my other challenge to the state would be that most of these individuals are property owners and they pay taxes, not only in the county, but also the state. Therefore, they should be provided COVID testing, and the purchase order should cover our international travelers coming into this community. So that's the other thing that I'm reporting back to the state and that I'm holding firm on for our community here in Point Roberts. Again, I know there's confusion. It doesn't seem whatever I publish, someone becomes subjective and they try to dismantle it and they make up their own opinions about what I published. I can't help that, and I do the best I can with what I've put out to the public so far. We've had people come in. We've had people come into the office after the testing today. How many, John? 5 people come in and saying, well, they need COVID testing. And I don't know how many times I've posted, on COVID testing. Pat, you have it on the All Point Bulletin when COVID testing is as well. I've put it all over Pause, Point Interface, Next Door. And we still have people that have no idea when COVID testing is. And now, they're stuck here until Sunday because we don't test until Sunday. And it's, until Monday because we test on Sunday and the results come back on Monday. At some point, people have to take responsibility to understand that they may be invoiced for the COVID testing and have the responsibility to know when we do COVID test. My volunteers, including my community volunteers that have stepped up and come in to help us during these testing processes, we're not able to add another day. A lot of people asked me to add Saturday as a testing so people could go home on Sundays. And I've denied that we're going to be adding Saturdays because Sunday has become a classic day for us for our permanent residents here in Point Roberts to make doctor's appointments on Mondays, Tuesdays, and Wednesdays, right? Or Tuesdays and Wednesdays. And then, the Wednesday testing is good until Saturday morning at 11 a.m. So we're doing the best we possibly can. Again, we did 170 today.
Do you know what proportion of those were Canadians?
I'd have to say probably 95%.
Really? And are they like temporary Canadians, not like Canadians who live here, but like who came down for see their cabins or?
Yes. Yeah.
Wow.
They're in town for their property, cleaning up their properties. Yeah. But I'd have to say it was probably a good 95% of the total today.
Some of them have never had a COVID test.
Yeah. Some of them have never had a COVID test. So, we had some people that pre-medicated themselves before coming through because they were so nervous about getting the COVID test. But I think overall it went well. And again, I'm very proud of our team. I'm very proud of the volunteers that are here and that are helping us. This Sunday is going to be a huge test for us. I think we'll have the same amount of people this Sunday, if not more, for the COVID testing. And then the big event of vaccinations in the afternoon.
Okie dokie. Well, thank you very much. And if I could get that contact, that'd be great.
Yeah, I'll share that with you.
Oh, Bill has a question. What's your question?
Hey, Chief,
Yeah,
Chief,
go ahead.
real quick. I sent you an email. Thanks very much, by the way. I'm going to be in that shot group on Sunday. But I took one of my clients down for Circle of Care yesterday, and she asked, how do I get in on this? Because she's not very good at access to email and so on. And she had your boys last time came to her house and gave her the shot. So I sent you an email about it, but you have, I know you would probably had like a bazillion emails.
Yeah, and we don't know.
But she was asking how,
Sure. I don't know if we'll be able to get out to residents this weekend, but we're also doing shots on the 21st. So the following weekend.
Okay, so how do I get her on the list? I did send you an email with her name
Okay.
and
I'll check
where she's at, but I know, you're probably buried with emails.
Yeah, and I would appreciate you reaching out to me next week if we're unable to get to her.
Do that.
So reach out to me next week if we're not able to get to her this Sunday. Again, I think it's all hands on deck with.
Okay, that's fine.
Yeah, with all the volunteers that we have, we're going to need every single one of them this Sunday.
That's fine. That's fine. I'll just send you an email next week, okay?
Great, thank you so much. Go ahead, Elizabeth.
Hi, Chief Carlton. So you just said that October 21st is another vaccination date.
November.
And this, November, sorry. Yeah. So this may be premature, but do you happen to know if they'll have Pfizer at that event?
Yeah, we don't plan on having adult Pfizer until January because that's when our Pfizer groups come available to get their boosters.
Oh, okay.
So if you want to get a booster.
No, I'm looking for my second shot of Pfizer. I don't want to mix my vaccines.
Sure. Are you able to travel to the mainland?
Yes, I believe I am now
So,
that it's open.
I would say call Ferndale Pharmacy.
Ferndale.
It's called the Ferndale Pharmacy in Ferndale.
Thank you. Okay, will do.
They'll probably be able to get you in any day that you want.
Okay, thanks for that.
Yeah, you're welcome.
Anything else?
Nope, just now we have to go into the budget.
Okay, so no new business. Anybody have anything new? Okay, all right. At this point, we will adjourn our regular meeting.
Budget.
Oh my goodness, the budget, I forgot. I'm sorry.
Yeah, we'll go through the budget and then we'll go into executive session so people don't have to stick around if they don't want to. Okay, I'm going to be sharing our budget here, everybody. Okay, can everybody see this?
Yep.
Okay. So to explain this document, legally, we're able to take what is considered a 1% levy increase each year by law. This year, due to some factors, it's that 1% actually only equals the 0.62118, which gives us amount of an increase to our 2020 levy of $3,895.17.
Chief, sorry to interrupt.
Yep.
The other email before I added that, that refund amount. So the resolutions, it's only a few $100s, but I'm not sure if you want to pull up that latest email that I sent you a few days ago to go over that one.
Give me 1 second.
And that was the email. It was sent Thursday.
It was sent Thursday. Okay.
Yeah. Thursday, the 4th.
Was that, it was Thursday. Oh, I see it. Okay. Yep. I'm getting there. Thanks for being patient, everybody. That's the correct one, Patty?
Yes, that's the correct one. Thank you.
Okay, so the 1% is that 0.62118. It gives us an increase to the 2020 levy of $4,228.05. The 2020 levy, and then you go over to the total increase. So going to the 2021 levy was $627,063.70. If you add in the 4,228, that gives us 631,291.75. We have other revenue, which I'll explain coming up in the review, and that's 22,800 is what's projected with that. So that gives us a total operating or funding budget of 654,091.75. Our division budget line item for 2022 is $638,001, which gives us the potential to have at least $16,090.75 going into our capital reserve fund. And that is if I would spend the entire $638,000. So that reviews that document. Okay, so to go over the divisions again, I haven't received any type of emails or anything like that. Chief Shields, he brought some stuff forwards, which I think we can just go ahead and absorb in the division that it's going to be coming out of. We have hydrostatic testing of our air bottles coming up in 22. How much is that? 2,000 something. And then we have to do our SCBA fit test. It's a mask fit tester, and we have to get that maintained, and that's another $3,000. And that covers sending it there, getting it maintained, coming back. Everybody that wears an SCBA has to get mask fit tested, and it has to be compliant with OSHA and NFPA standards.
How often is that done?
Well, yeah, whenever we test, once a person's tested with their mask, that's it. They don't have to be tested every time, but we have to get the machine calibrated and stuff once a year. So we're going to be adding $5,000 to the division that has the SCBAs into it, but I think we can absorb it. We're not going to add it. I think we can absorb it in that division as is. Oh, so the fit tester is for 3 years. Okay, that's good. That's good to know. Okay, so I'll explain this for everybody. This is our budget for 2022. Again, the tax levy gives us $627,063.70. Public hospital district rent to rent the space from the fire district is $16,000. Fire service contract fees, $300. Interest on investments, we project that usually low. It's $3,500, and burn permit sales $3,000. That gives us the additional funding of the $22,800 in regards to all of those put together. Gives us a total operating expenditure or money received of $654,091.75. So the 2021 budget, you can see where we compare the two. It was 649,000. 2022 is 654,000. So this is comparing 2021 to 2022 budget. So that's an increase of $4,228, which is that 0.62118%. Okay, which gives us that correction there. The things that we changed in the legislative division was the audit, because we've gone through that, so we didn't need any more funds for an audit coming up this next year. So we deducted $2,500, zeroed out that line item. We added $3,500 to insurance. So our insurance is through ESIP McNeil and Company, and that covers all of district volunteers, functions, but the entire district. That would be all apparatus, all computers, internal office equipment, the building, and the land. So it runs us about $32,000 a year, and it's a 3% increase a year. So that's why we increased it. We added $500 to election charges, and that's due to Commissioner Lester, which went back for election this year, and you won. Commissioner Lester won her position again. And in December, you guys will have to remember to do officers for the following year. And then we have to pay those election charges. It's amazing. We get charged for that, but we do. So it's an increase to the legislative division of $1,500 for 2022. Things that we've changed. So my salary went up in 2020. $66,500 is staying that in 2022. My contract comes back up in June, July for a review of that. So usually it's lagging behind is what happens. But that was an increase of $3,158. We took Chief Shields to $40,000, which was an increase of $1,890. Finance manager got an increase of $267. We went down to the FICA Medicare left retirement, which is law enforcement. The LEOFF is law enforcement officers and firefighters retirement. So we had to add, since our salaries went up, they charge us more money for that. So that had to add $330. We increased the FICA Medicare for the finance manager due to her increase by 20. Department of Labors and Industry, we had to increase that by 200. Communication tower contract goes up by 3% every year. So we have that with Whidbey, and that added an increase of $165 to us. The communication tower repair and maintenance, we have maintenance done on it every year as well. We increase that by $500. Tahoe repair and maintenance, which is my vehicle, we increase that by $250. Professional organization dues, like to the International Association of Fire Chiefs, Washington State Fire Chiefs, and other organizations that we pay dues to, we increase that by 100. So that division, which was the administrative division, that division increased by $6,880 for 2022. Suppression division, volunteer firefighters, we set aside $75,000 for stipends to be paid out to our volunteers. That includes all 46 or 44, I guess, without John and myself included in that. So we have $75,000 set aside for the firefighters for their time spent in this community. $500 increase to the marketplace, and that's where we get our general supplies from. We have a $50 increase for firefighter accountability tags. We have a $500 increase for the fuel. So obviously everybody understands the fuel costs that we have today, and we had to increase that. That might be a little low, but hopefully if it goes over, we can absorb it in the division itself. Hose repair and maintenance and supplies, we increased that by 500. SCBAs, we only have allotted 4,500. And again, we're going to be running over 5,000 on that line item. So it's just to make sure we should be able to absorb that in this division. $300 increase for hose testing. Every year we have to get every length of hose that we have tested to meet NFPA standards. And we have a private company that comes out and does that down in Ferndale for us. We have dispatch fees. So every call that we go on, we get charged for from our dispatch center. So we have to pay them fees for the calls that they tone us out on. $50 increase for specialized emergency response program, which is the SERP program, and that's hazardous materials. So for the suppression division, we had an increase of $2,750. Sorry, let me get to where I was. Yeah, $2,700 on that increase. Suppression training division, we added $1,000 for suppression training materials. We added $250 for instructors. We added $500 for live fire training. Our hope is that we're able to connect with Delta Fire Rescue and utilize their fire training facility at the airport, which is much closer than having to go down to Bellingham at this time. And going to Bellingham takes us about an hour, hour and a half to get a fire truck down there through the border with our firefighters and everything else. So their facility at Delta Fire Rescue is a state-of-the-art facility. It's different. It's propane, which is different than the burns that we've been doing, which have been Class A with pallets. But it's going to serve us well if we're able to come underneath contract with them. So I'll let you know how that goes. $1,000 got added to hazardous materials, and hazmat, we're going to have to be ordering more foam. So I'm trying to split that between two divisions. One division has foam in it, and then we added $1,000 to hazmat for here. And our foam is going to be being switched over to more environmentally safe foam without the PFASs, and which are have the potential to cause cancer in some individuals. The problem is our gear is made with PFASs. Our boots have PFASs, have these, they're called forever chemicals. And there's really nothing that I don't put on as a firefighter that doesn't have forever chemicals in it. They're getting better. The manufacturers are trying to get better at making stuff that doesn't potentially just automatically start the cancer clock on us just because we put it on. But we have a ways to go in what we wear, the bunker gear, the boots, the helmets. We have a ways to go in that area. So we're going to be starting to switch out our foam this coming up year. So suppression training division was added, got an additional $2,750 in that division added for 2022. Maintenance division, miscellaneous small tools and equipment is where we start out. We added $50 to communications, cable TV. For the firefighters, generator costs, we have a big generator in the back of the station, and those costs go up every year. We have to have it fueled. Is next year, or did we already have the major maintenance? Yeah, so we had a major maintenance on it this year, so we expect that to do fine in cost for this coming up year. Facility maintenance station upkeep, we added $500 to make that a $10,000 line item. Garbage collection, we added $200 to that. So the maintenance division, we added $1,250 to that division for 2022. EMS division for our EMTs and paramedics. Volunteer firefighter EMS, so EMTs and paramedics, advanced EMTs that cover shifts here for this community are paid out stipends. That stipend item line is $84,000. So we added $100 to oxygen supply. We actually have to go down and get oxygen in big bottles so we can refill our smaller oxygen bottles here as well. 858, which is our red ambulance repair and maintenance, we increased that by $500. Battalion 58 or brush 58. I would say that's yours, right? Battalion. Yeah, because it's not brush. So battalion 58 repair and maintenance, we increased that by 500 to give that 3,000. And so we had an increase of 1,100 in the EMS division. EMS training division, we added 500 to supplies and equipment for our EMTs, advanced EMTs and paramedics. Books and publications, we added 200 to that line item. And so that gives us an increase for the EMS division of $700. Again, the total increase for the 2022 budget is $16,880. That gives us a divisional line items expenditure of $638,001. The total budget for 2022 is $654,000, if I believe, if I remember that correct. Is that correct, Patty? $654,000. You're muted. Still muted. You're still muted. Just nod. 654,000. Is that right?
Pardon me.
Okay, there you go. Thank you.
Operator error gets me every time. The total budget for 2022 is the $638,001, which is the increase of the $16,880 over 2021's budget of $621,121.
Right. And then the expected income for 2022, that's 654,000.
That is, let me scroll to the top of mine here. Yes, $654,091.75 is the projected total income.
Okay.
Because there will be remaining unpaid taxes from previous years. And then there will be a new construction adjustment at the end of the year made by the assessor's office. So
okay.
The total projected amount that we know of at this time.
Right. Okay, so I'll take any questions regarding the presented 2022 budget.
Any questions? Additional questions? Anyone from the audience want to ask a question?
Anybody have any questions? Yeah, I want to say that was there. Rush 58, 5193.
Oh, okay. Oh, it's not correct.
Okay, no questions?
So we need a motion to accept the budget as prepared for the year of 2020.
I move that the budget as presented be accepted.
I'll second that one. It has been accepted.
Okay, we'll make the changes. We'll confirm the changes, make those permanent, and then we'll publish this to all of you and to the website.
Great. Thank you. Very well
Yeah.
done.
So the, Patty,
Yes,
the, resolutions, are those
Yes.
changed at all?
they have changed to reflect that small levy increase. So those are also in that email attachment to you.
Okay, so let me get back to that.
Okay.
Okay, so this is resolution 2021-03. Yeah, I'll. Go ahead and go over this, Patty, for me, please.
Was that what was in the email? Because that is the old one.
That is the one in the email.
My apologies. I believe. Okay. Let me double check the one that I emailed John that is also correct. Let's see. Well, I'm pretty sure the one that John printed, it should. Is John there in the room?
He is.
Okay. Can he verify that resolution -03, that middle amount there, the amount in.
4,228.05.
Yep, that's what that is.
So that's the correct resolution. So everybody that's watching, this number here, the 3,895.17, that number is corrected to 4,228.05. So 4,228.05 is this number. Everything else is the same on this.
Well,
resolution.
the 630,000, that has been changed also to 631,291.75.
Okay, so say that again, 631. So that's correct. So the 631,291.75 is here now.
Yes,
Okay,
correct.
and 4,228.05 is here, just for the public
Yes.
watching.
Yes.
Okay, let me see if I can bring up the O2. Is this correct, Patty?
Just one second. I was verifying.
It's the 3,895.17 again.
No, so you must be pulling something that you have saved, because I just pulled up the email I sent you, and those are correct as they should be.
Okay, just for the public, so we can get through this.
Sure.
So the public knows this is $4,228.05. This number down here.
Yes, correct.
Okay, so that's changed on the resolutions that the commissioners will be signing. So 4,228.05.
That is correct. And
Okay,
so the motion that we're looking for is to adopt first resolution 2021-02, which states the levy increase in dollars and percentage. It states that the district is taking their 1% levy increase for 2022, which is the 0.62118%, and that is $4,228.05 increase over this year's levy. And then resolution 2021-03 Also adopts the 2022 budget and it certifies the levy for 2022, also restating that amount that we had gone over.
So do we need separate motions for these, or can we do them as a?
I would say separate.
So, I need a motion to accept the resolution of 2021-02. I second that. Okay, it's been moved and seconded and it is passed. And then we need a motion for the resolution 2021-03 to be accepted. I then move that we accept.
I second.
Okay. It has been passed. So do we need anything, Patty, to finalize this?
No, just signing those at the end.
Okay.
You.
All right.
I had some difficulty with the audio. Both motions were made by Commissioner Harper and both motions were seconded by Commissioner Newman.
2021-02 was made by Commissioner Newman, seconded by Harper.
Okay,
2021-03 was made by Harper, seconded by Newman.
thank you.
Okay, so at this point, no further business. We will adjourn to an executive session. I anticipate that we will probably need 45 minutes. It could extend a little bit longer than that. And then we'll come back in session and adjourn.
Okay. So for the public, we're going to adjourn into executive session for employee discussion. And after that, we'll come back and we'll finalize the meeting for today. So you don't all have to stick around for that. We're actually going to be leaving the room here. And I want to thank everybody that participated today in today's meeting. If you're not here when we come back.
Thank you for coming.
Thank you.
Thanks, Chief.
Thank you,
Thank you.
everybody. Okay, we're back from executive session.
And we've had a discussion, which we will not enter into at this point. And I'm going to hope that you will give a motion for adjournment.
I move this meeting of the fire commissioners be adjourned.
I second that. It is adjourned at 5:55 p.m.
5:55 adjournment. Okay, Linda, thanks for hanging around. Okay.
Thanks. Have a great night, everyone.
Same to you. Thank you.